I'm Dr. Joshua Shiffman, and I'm a pediatric oncologist here at Primary Children's Hospital in Salt Lake City. My story actually began when I was 15 years old, and I was diagnosed with a childhood cancer. It turns out it was my own father who diagnosed me with Hodgkin lymphoma, and I basically was thrust into the world of pediatric cancer. Every day, my father and I would get in the car at noon and drive to Boston, where I'd get my treatment, which was about an hour away. I'd get zapped with radiation therapy, I'd drive back for an hour, and I'd spend the rest of the night completely sick, hugging the toilet bowl and basically vomiting from the side effects of the radiation. And then I'd do it all again the next day. So I knew, there's got to be a better way to take care of this disease. Being a Hyundai Quantum Award winner was a great honor and literally left me breathless when I found out that we had been given this great award. We're going to be doing research on a disease called osteosarcoma. Osteosarcoma is a very rare but aggressive form of bone cancer that often occurs in children and adolescents. With osteosarcoma, we are actually using the same exact treatment that we had 40 years ago. We have not successfully introduced a new drug in 40 years. So this is a really important disease to study because it's so rare, but yet so aggressive. It only occurs in 400 or 500 new children per year total in the United States. The cure rates for osteosarcoma are about 70% if it's caught early enough and localized in one spot. But if it's already spread, the long-term chances of survival are less than 30%. And that number hasn't changed in 4 decades. That's why we felt it was so important to focus on osteosarcoma for our Hyundai Quantum Award. Now we know from years and decades of research that you can make mouse models in the lab. It's not unusual to have mice or rats that develop more cancer and try to study those to help our patients. But again, here the idea previously was always, let's look at these mice that are getting more cancer. But not many people were focused on the opposite end of, let's study animals that have less cancer. You and I each have, hopefully, 2 copies of a gene called P53. There are over 22,000 genes in our body. Each gene has a different job to do. P53 is known as the guardian of the genome. It's the superhero of our DNA. P53 is able to actually kill that cell so that it can't go on to develop cancer. Well, elephants, instead of having 2 copies of P53, they have actually 40 copies. So over millions of years, an elephant has figured out a way to avoid cancer, and now we, in the lab at Primary Children's Hospital and Huntsman Cancer Institute, with this amazing funding from the Hyundai Quantum Award, are working to take that natural cancer resistance found in elephants and to try to figure out how to use it as this new medicine to eventually help children with osteosarcoma. 80% is not good enough in terms of survival for childhood cancer. We need it to be 100%. One child with cancer is one child too many. And even these children that we cure still suffer from chronic disease. There are problems with their hearts, there's problems with their lungs. So it's not just about curing the patient and getting rid of the cancer. It's about curing them in a more humane and gentle way without the side effects, without the long-term toxicity. There's always reason to hope. Always, always, always. We're still developing new drugs, and there are new clinical trials that are being offered. There is an army of clinicians, of pediatric cancer doctors, of researchers working every single day to try to come up with new treatment approaches. Ours is one of many, and that gives me a lot of hope. And it may in the end be a combination. And for the child diagnosed today, we're doing excellent. But the message is, we could do even better. Childhood Cancer Month is especially important to me as a childhood cancer survivor, as a childhood cancer doctor, and now as a childhood cancer researcher. I can say that there can never be enough focus on the issue of childhood cancer and the needs to continue to study and advance and cure children with cancer. My name is Dr. Joshua Shiffman, and my handprint tells my story.